supply chain management. She excels in steering innovative projects from successful business. As a sixth generation we work together in High Point by bringing of the International Society of Clinical Densitometry. Dr. Johns enjoys music, lifelong learning, entertainment, spending time with his wife, children, family, a good laugh, good food, and good laughter. Welcome. Thank you to all of our panelists. Audience, I hope you enjoy.
First of all, good evening and greetings to everyone. Greetings from the High Point NAACP, and thank you all for deciding to attend this evening's event, our first Black Agenda Forum on Healthcare, which amplifies our commitment to access to healthcare, one of the pillars of our policy-based reparations initiatives. The Black Agenda Forum on Healthcare is a conversation to engage, energize, and mobilize the community around specific social factors that are affecting healthcare of Black citizens in our community. So I'm going to set forth some rules of engagement. All online participants are muted during the forum. Chat session is disabled. Question and answers will be open for questions for online participants. Question and answers for in-person participants will be submitted via index cards. Questions for the panel have been developed to place context to the discussion, and then the floor will be open for questions as reference. Online questions will be monitored, retrieved, and communicated. In-person questions will be written on the index cards, and that should be available to you when you enter. Is there anyone that did not receive an index card this evening? And those cards will be submitted to me to be read to the panel. Information can be found on the tables in the rear of the room, as Dr. Harrison had previously indicated. The forum will be recorded and made available on the Williams Memorial YouTube channel. Again, our panel is Ms. Courtney Austin Wilson from the North Carolina Association of Black Farmers, Ms. Carter Wade, North Carolina Medicaid Enrollment Broker, Dr. Samuel Altador, Primary Care Nurse Practitioner, Oak Street Health in High Point, Mrs. Vicki McKeever, Councilwoman of Ward 1, and Greg Venable from the City of High Point, Transportation Director. All right, so this point we're going to begin, okay? So the first question will be directed to Ms. Courtney Wilson also, okay? What is the North Carolina Association of Black Farmers, and how can the association enhance its visibility and impact in the Black community?
Thank you for that question, and thank you for having me this evening. I would like to start out by saying the North Carolina Association of Black Farmers was created last year by a group of Black farmers down east, and it was for the sole purposes of bringing our numbers together. And we can take example here today. It's power in number, and until we come together as a group in our Black community and really focus on what we really want to see our outcomes to be, we are determining our own destiny. And it shows tonight that our community is not really concerned about healthcare. I know Dr. Harrison put a lot of time into this and a lot of effort into wanting to make change in our community. But we have to some kind of way have to come to Jesus meeting and say that these are the things that really are important to us. And if we're really concerned about our healthcare, concerned about the things in our access, then we can show up for it. So I made a little joke with the doctor here and said, if we were giving out something free, a lot of people would be lined up outside 1,000 cars to get something. So it's almost like we're gonna have to trick our people to getting healthy. And the association was built by 3 other farmers, Kanita, which is a farm down east, Reverend Joyner, myself, and the oldest Black dairy farmers of North Carolina, the Barkers. And we spent a lot of time in DC and a lot of time in legislation talking to our federal government about how does it trickle down and what does a Black farmer truly look like. We can only speak to North Carolina Black farmers, but in the whole, we don't have a presence in America. And we came together instead of complaining all the time when we go to DC and to the state legislature and to our House of Representatives. It's always like we're complaining. But we don't, one thing I noticed in that room when we went as individual farmers, where we weren't collective. So we needed to come together. White groups come together, they have a base, they have an organization, they have structure. And those are things that we lack in our community. So my eldest son, we came together and created the North Carolina Association of Black Farmers. And in that, we recognize that there are less than 1,700 Black farmers in North Carolina. Well, we call ourselves having food deserts. We can't fix a food desert if we continue to wait on some heroic person to come save us. We have to show action. So the North Carolina Black Farmers Association is an action organization. It's an organization where we're identifying the Black farmers in North Carolina. We're identifying that Black Americans have less than 0.5% to white Americans that have 98.9% of land. When we talk about equity and inclusion, we just need to get out here and buy more land. When our ancestors come out and our kinfolk call and say, somebody wants to buy the land down east, or somebody wants to buy the land in South Carolina, we shouldn't be jumped to sell. We should keep that land. And that's one thing that North Carolina Black Farmers Association is. We're bringing education and resources to our community to educate and say, hey, in that 1,700, I'll say this, there's 52,000 farmers in North Carolina. There's only 1,700 Black farmers. We've identified about 300 to be true farmers, and then the rest we have are gardeners, not producing any streams of revenue for themselves. So the association was created to be able for us to go out to get government contracts, procurements, we're in school systems, where we purchase the vegetables from the local Black farmers at a higher market value price, where we're bringing revenue into their farms. And in return, we're providing that fresh, non-GMO, no pesticides, no herbicides, organically grown foods on our Black soil land. We're providing that to our children at school. We're providing that to our prisoners, our brothers and sisters. We're providing that to our grocery stores. So we can be impactful, but we have to be impactful with numbers. We have to build these seats up. If we're so concerned about our people, then this room should be filled. So in a sense, our community should be ashamed of themselves for not being here and wanting to take part in this. We were part of the One High Point Commission. We learned that Black people have a life expectancy about 17 and a half years less than the opposite side of Main Street in our own town. We own no businesses here, but we give ourselves each and every day. We give our labor, but we don't have any equity. So we need to fill this room the next time Dr. Harrison has an event like this. We have to go door to door, knock on our doors, do whatever it takes to be able to get our community more engaged. If it's a rapper that we need to come out and have people come to get our younger group, well, then that's what we need to do. But we need to meet people where they are. We have an organization called Glow House Agriculture, which is getting food into the community. So we go to DC, we get large lump sums of funding from USDA, and we bring it back and we're intentional. We've been very impactful in Williams Memorial here at this church and able to give their congregation hundreds and hundreds and hundreds of thousands of pounds of vegetables to be able to change the narrative on how we look at fresh food. So I hope that is some of the things, and we're at many churches and many places in the community being impactful. So our goal is to be able to spend over $200,000 this year just in High Point alone on fresh food options. But nobody's knocking down our door to volunteer. So that's another thing we'll talk about later on. About how we can all come together and team up. There's power in numbers. And that's one thing we need to really recognize in our community. We are our own saviors. And we're only waiting for ourselves. But if we continue to say there's no grocery store, we have no access to fresh, healthy food, we don't own the businesses in our neighborhood, then again, shame on us. We should be shown the action. We are who we're waiting on.
That's great information. The next question I have is from Ms. Cartwright. What does the move to North Carolina Medicaid managed care mean for North Carolina Medicaid recipients? And what do the health plans offer in addition to Medicaid?
Great, thank you for the question. A little bit of background. On July 1st, 2021, the majority of Medicaid recipients in North Carolina moved to a standard plan, What that means is the services are the same, but they're getting it through a health plan. And they're able to choose that health plan, and as they have their redetermination and are get Medicaid again, they can also choose at that time. But this is where the plans are providing the care, again, it's the same services coming through a health plan, but the health plans offer additional services. They brought this to the table, this is on their own. So this is where they're bringing benefits such as help with after-school care, prenatal, asthma, transportation, education vouchers, all kinds of things for families, and each plan is a little bit different in what they offer. It's important for the families and the recipient to determine what's most beneficial to them, because as a North Carolina enrollment broker, we're an unbiased third party. Our goal is to help educate people about the changes to North Carolina Medicaid, which is a really exciting time with expansion going on right now. But as far as the plans, the standard plans, who are what I'm referring to, there are 4 available in Guilford County, and they're Healthy Blue, United Healthcare, WellCare, AmeriHealthcare, TOS. And again, you can go on our website, ncmedicaidplans.gov, and you can go and look up, and you can do 3 plans at a time and look at them across like you would do on healthcare.gov, and you can see line by line the different things that are offered and do a comparison. But we don't necessarily have all most current information, so we encourage folks to go look at the plans website that they may 1 or 2 or 1 that they really like, and see what all the different added services, because those could change, and their website wouldn't be as current as the plan's website. So this is a really exciting time to have these additional services available. But managed care has, like I said, been going on for a couple of years, but it's still something people are learning about, so we're glad for this opportunity today to help educate people about what the plans are. So some people are not moving out of managed care right now. They're going to be moving out of Medicaid Direct. They will stay in Medicaid Direct because their services and needs are best met by Medicaid Direct. If they were going to be moved to managed care already, they would have gotten a letter, or maybe they apply now, and based on their application and their needs, they may go and Medicaid Direct or go over to the standard plan. And I want to point out before I finish that we have at the back of the room, Kirby Buford, who's an outreach coordinator for Guilford County, and also the wonderful Ms. Shea, the Guilford County DSS. So they're both here today to help provide information, which is waiting. So thank you.
Excellent, thank you for that information. All right, we're gonna move to Dr. Sam. Dr. Sam, can you please paint a picture for us as the kind of services and follow-up Black patients will receive at Oak Street Health Centers?
Thanks for the question, and also thanks for having me. Oak Street Health, what we are basically a primary care clinic. We take care of adult patients on Medicare, meaning that the vast majority of our patients are 65 and above. As far as the type of service we provide to our patients, including the Black patients in the community, our focus is a lot on preventive medicine. Okay, so what the type of service we provide primary prevention, which includes vaccination, vaccination for flu, COVID, pneumonia, shingles, or whatever the case may be. We also provide secondary prevention that includes a lot of screenings. Screenings for COPD if you're a smoker, screening for colon cancer, screening for breast cancer, also screening for cervical cancer, and also we provide tertiary prevention, which includes chronic disease management, meaning if you have conditions such as high blood pressure, conditions such as type 2 diabetes, we manage those conditions in order to prevent more complications down the line. That is the kind of services we provide to the Black community in High Point.
Excellent. Thank you so much. All right, for Councilwoman McKeever, in your estimation, what are the primary issues that you hear about in Ward 1 that most concern your constituents in regard to healthcare access?
The most concern that I've heard in Ward 1 is food desert, infant mortality, health variety, and also economic opportunity. And so with all these, we try to work together and come along and try to find answers to help these people understand. And also, we look at the fact that about food desert, that's one of the biggest ones that they have talked about in my ward, had a lot of concern about in our ward. And my thing is, I would like for people in our community to come together. I think the lady on the green about her farmer, get fresh food. But when you look at it, the overall picture, most areas in our city do not have grocery stores. And it's mainly in the Black community. So how can we expect our Black community to be able to eat healthy? They don't have access to healthy food. So in order for our race to get healthy food, then we need to be educated. We need to communicate with our people and let them know the need for it, and also have access to transportation. Because right now, we don't have that, and so I look at the overall picture and I think about healthcare depravity. Many people in low-income areas, they don't know a lot about healthcare. It's where they were raised up, and they learn from their parents, and also they eat what they have in the home, because a lot of them don't have a lot of income coming in, so therefore they eat what they have at home. But if we can reach these people and let them know how important it is for the Black people to eat healthy food, then maybe we can cut down on high blood pressure, high cholesterol, diabetes, obesity, because it's really, really high in our Black community. So that's one of the main things that I'm concerned about in doing that. And also infant mortality. When I was looking at the infant mortality in the city, and what I saw was very, very shocking to me. And all the infant deaths here within the city of High Point, 66% of them were African American. That's a lot, 66%. And I just was shocked. So my goal is to try to find a way that we can reach out to these people. I think we need to get programs together and teach them how to take care of their pregnant, how to take vitamins, make sure they get the vitamins and medication they need, because a lot of them don't have access to this. So the main thing is we got to get transportation. We got to get out there and communicate with our people, and also educate them on how important it is for healthcare in their life. Thank you.
Speaking of transportation, that's a perfect segue to Mr. Greg Venable. So, Mr. Venable, transportation to allow access to healthcare is a known issue in underserved communities, as you've heard. What efforts are being made currently in the transportation space in the city of High Point to support the ability of High Point citizens to access transportation in areas inside the city and outside the current boundaries of transportation to and from healthcare facilities like Oak Street Health?
Thank you. So I'll kind of start with what we're currently doing from a transit perspective. Then I'll talk about some of the things that we're looking into about possibilities to improve our transit system. So for places like Oak Street Health, we currently offer our fixed route system, which is the large buses that run our various routes throughout the day. I think the Oak Street facility in High Point is on South Main Street, so we have Route 11 that runs there. And so for those who have the ability to ride those fixed route services, that is available. We have two services that are available that if you're over, the first is access, the entire system is called the Access Program. We have a demand response, and then we have a paratransit, ADA paratransit service. So the demand response is a service that is for those folks who are 70 and older. I think the cost ride is $2.50, but you can call and make an appointment to receive transportation. We use the smaller buses, our paratransit access buses for that service. And so they will take you anywhere within the city limits of High Point if you're over the age of 70. Our ADA paratransit service is available for those folks who have a long-term disability or a temporary disability. And that service is available. Again, you call in and make an appointment. They will take you within a 3/4 miles of our existing fixed route service. So those items are available for getting folks to where they need to go in High Point. Currently, and we hear this a lot as far as how do we get, so you have people that live in High Point, but they have a doctor's appointment in Greensboro. So that is one of the challenges with our current transit system is how do we meet the needs of those folks. One of the ways is Guilford County Transportation they offer a service similar to what I just explained, that you can call ahead and Guilford County Transportation will take you from High Point to Greensboro. Again, that's for if you are of that age, and there's maybe 65 and over, but they also provide that service. Just to go over a couple of things that we're looking at to try to enhance what we currently do, so that we can meet the needs of those that have the greatest need. We've talked for several years about extended service. So currently, we operate 6 days a week. Right now, we operate till 6:30. So we've talked about expanding that service, running till 9:30 during the week, extending the service on Saturday and running on Sunday. I think that would be very beneficial. We're in the process now of trying to hire additional drivers, additional staff to meet that goal. We're working on that. It's difficult right now in the hiring world trying to get drivers, but we've been really successful over the last probably 6 months in getting those additional drivers for that need. Some of the other things that are associated with that expanded services, I mentioned the Sunday service, an increased headway. So if the bus currently comes every 30 minutes, can we do that every 15 minutes? Or if it comes every hour, can we go to 30 minutes? So, a lot of the things in planning that expanded service needs to be in place. You have to expand we have cleaning crews that clean the buses and things like that. So you have to take into account all that additional costs, staff time and things like that. But we are working toward that. Another service that is relatively new in the transit community is a service called microtransit. I don't know how many of you have heard of that, but it's been implemented in a few locations across North Carolina. And it's more of a demand response service, similar to an Uber. But what that does is you'll come in and they'll identify areas where we don't currently have service or there is a need that we're not currently serving. And you'll provide service to either you will get folks to a fixed route system, or you can transfer and you go to one area to another area that maybe not be served by a fixed route. So there are several companies out there that do that kind of thing. So we have had discussions. There was a meeting today, as a matter of fact, with one of the companies that provides that. How that will look in the future, we're not real sure. So we're doing a lot of investigation on the other jurisdictions, municipalities that are currently doing that. I know Wilmington offers that service. The town of Wilson offers that service. So we're contacting those folks just to see how well it works and if we can implement something like that. But I think we can. But that's something that we are looking at to try to meet those needs. Those folks who need it the most.
Excellent. Thank you for that information. So the mayor of High Point, Mayor Steele Jefferson, has arrived, and I think he may want to have some words, so we'll stop at this point and let him come to share a few thoughts.
Sorry to break up all the fun like that, man. I can see everyone was buzzing from that. Dr. Johns, how are you doing? I'm doing well. Good to see you. How y'all doing? We appreciate y'all being here. Good evening. How's everyone?
Good.
It is a privilege to be here with you all and to be in this discussion. You all have the hour right here. I want to be respectful for everyone online. It's good to see y'all too. I'm excited whenever we get to have these kinds of discussions. For those who don't know me, my name is Cyril Jefferson, Mayor of High Point. I have the privilege of serving on City Council with Councilwoman Huber, and we get to work with great staff members such as Red Venable. Quite frankly, we get to work with all of you all here who are community partners here at NAACP. I see peacemakers. I got the wristband on today. Yeah. If you've heard me speak, then I don't want to sound like a broken record, but I'm just going to say a few things. When we, several years ago, decided that we would run for office, the big thing folks talked about was the economic tide that would lift all boats because High Point was going through revitalization. And if you've heard us talk about this, you know that we said that economic tide was going to lift the boats that were able to rise. There were some boats that were anchored down and some boats that had leaks. And that we had to do work to invest in those boats so that they could rise with the tide. So that meant we had to focus on equity. That meant we had to focus on opportunity. And we had to focus on access. So when we have events like this one, they're right aligned with us. It's the reason why we invested in the work of reparations. The reason why this past Monday we just voted to move from the phase of studying we did last year that got completed to actually implementing the work. Because we know that you have to be more than just talk, you have to be able to move forward. So a lot of things that they're discussing this evening are right in line with the vision of this city. If you've heard about the 2045 comprehensive plan, you know that High Point's got bold dreams for the next 20-something years. But those bold dreams don't get realized unless people are healthy in order for us to get there. They don't get realized while we have a 17-year life expectancy gap between those who live in 27267 and those who live in 27265. They don't get there as long as Black mothers are more worried about infant mortality and their babies dying in their arms or before carriage compared to any other mother. They don't happen as long as chronic illness pervades certain communities more than every other. We have to create parity, which means that we have to be very intentional, work across systems, work across lines, work across communities. And High Point is, I think, understanding how we do that. It's being able to bring the folks around the table, such as everyone here, to have these discussions. It's being really innovative. You know, I don't know if you know this, we want to be the urban agriculture capital of the world. We want to ensure inside the core of our city that we are using spaces right now where the city can give lots to urban farmers to be able to grow food. We've been doing that for the past several years because we're invested in seeing our city grow in an incredible way. And so I don't want to take away from all these great experts here. I just want to say that we're all locked in step. You know, I believe that anytime you have 2 or 3 gathered together, I'm not going to go there. But I just want to say thank y'all so much for being a part of this event. I'm looking forward to us continuing to work. Love y'all so much.
All right. So we're going to continue on with more questions for you guys to help us answer. We'll go back to Ms. Courtney Wilson-Alston. How and where can the Black community access the fresh fruits and vegetables provided from Glow House Agriculture?
Glow House Agriculture is right down the street off of Baker Road. We have a facility there. We are still in the process of updating some of our spaces as far as cut, dice, and slice for our school systems and foster cabinets. But we're out in the community every single week. Somewhere we are giving away 500, tomorrow we're giving away 700 boxes. We are deeply rooted within the housing, taken to the housing authority or taken to different churches within the community. But what we want to be able to do is change the narrative. We want to be able to have people not only go to glowhouseagriculture.com. We want you to be able to contact me directly. You can go to the website and get my contact information. But we are intentional about changing the narrative. So when we're giving away foods to Williams Memorial, when we're giving away to Temple, when we're giving away to Cedro, Memorial United Methodist, when we're giving away to Oak Grove, Shallow, I can't tell you all the churches, we are actively giving away, trying to build relationships, nurture relationships to get the food in the community, because one thing we know, if we give it away free, then maybe somewhere, someday, someone will change their mind about going to the grocery store, or someone will change their mind, and like the mayor said, we have these urban gardens. Well, one thing about those urban gardens we really have to look at, they need resources. They need more than they have, because what they're not being able to do in those urban gardens are to provide for their communities. You know, agriculture is not just a little strip patch of like a garden. We need to be able to feed our community in masses. We need to be able to have the city donate acres and acres of land to be able to have a farm, to be able to sustain the Black community. We need to be able to have a Black owner of a grocery store come to our city. They're out there. We just need to be able to date them, court them, and get them in our city with economic development. But Glow House Agriculture is here. We're deeply rooted. Like I said, I'm a 6th generation farmer, and we're intentional about changing the dynamics of our community. So right now, we're in several different programs where we're giving away food in the community, but you can subscribe. So just like the doctor said, preventative medicine, take a subscription. There's a fresh box of healthy vegetables with no GMO, pesticides, or herbicides for $35. And what you're doing in that $35, you're not growing meat, you're growing the Black farmer. You're growing that supply chain, that whole supply chain from the person that transports the vegetables to the person that builds the boxes and makes the boxes and the labor that we have. One thing I wanted to direct my energy on was transportation. We have got to do something about transportation in High Point when it comes to Black people, Black bodies, and Black communities. I try to employ 20 people, $13 an hour. They can't get to work. It's a story every single day. I loaded 200 boxes the other day by myself, packed them, loaded them, and delivered them because no one could get to work. I'm not a cab service, you know, I can't be in all places at one time. I can't possibly go pick up 7 people, but 7 people seem to not have transportation. That is our labor. The most challenge we have are them getting to work. It's in their community. It's right down the street, but they cannot get to work. So somewhere in there, the buses aren't working for them. The cabs are too expensive because they're, again, from a socially disadvantaged, excluded group of people. So somewhere in there, we're gonna have to come up with something creative that has door-to-door. It's an underserved community van or something, and it picks people up and it takes them to work. Somewhere we're gonna have to fill in that gap because it is a need for it, as well as a desire. People wanna work, but they can't get to work, and that's a sad thing. And it's right here in our community. So, but the fresh vegetables are always available when we talk about preventative medicine and we talk about subscriptions. You go to the grocery store, we spend $1,000 at the grocery store on unhealthy foods. We have food pantries everywhere, food pantries galore, giving out processed foods. We have to change that. We have to look at fresh food as our only option, not as a secondary option. We have to look at when we're going out after church or when we have these repasses at church. We can't take green beans, canned potatoes, chicken and potato salad. That's our favorite meal. It's killing the people that we went to the funeral. It killed them. Why are we still eating it at the funeral? It makes no sense. When you repeat the same cycle, it's called insanity. And our community is really insane in a lot of ways because of the same practices that we practice. When we're in church every Sunday, we're here. At that time, we should be preaching about the Word of God, but we should be preaching about other things that are affecting our community. We should be taking that time. If we got 200 Black people in one room, we should be taking that time talking about Job and Peter and Paul. Talk about what's going on with John down the street and why he can't get transportation and how we can come together and give him transportation, or how we are poisoning ourselves with the foods that we eat and how we can change the dynamics. There's a fresh box of food outside that they can go home and cook. Not let it rot or let it spoil or say, I don't eat beets. Try to find a narrative for that. So one thing we do have is when we do our fresh vegetables, we take them out in the community, but we have a team of chefs. We prepare the food. We meet people where they are. If you don't know what a sweet potato tastes like, let me prepare it and show you. How do you prepare collards? How do you prepare kale? Kale is a superfood. we should be eating these things. We should change the narrative. So it starts with us in this room today.
Absolutely. I just want to ask a couple of clarifying, just because I'm curious now. So I hear you say that you give a lot of free food, okay? But the community cannot be sustained on free food. So you mentioned the subscriptions. So how often, like if you pay $35 for subscription, how often do you, like, what's that box? How long is that supposed to last?
So you can do bi-weekly subscriptions, monthly subscriptions, or weekly subscriptions. That $35 box weighs about 10 to 13 pounds. It has an assortment of vegetables. It comes with a recipe card inside, and it feeds about over 6 people, 6 to 8 people. So you can get not one meal, you can get 5 meals, but it's all about how we educate our community and how we prepare that box. We also have a protein box that gives you chickens, farm-raised chickens from our Black farmers. We have a box that gives a protein, so you can have a beef or a chicken in the box. We have a fruit box. And those all range, but one thing we have to get our minds wrapped around is we'll spend $75 to $150 on this pair of sneakers all day long. We'll buy some pair of Louboutins for $1,000. We have to take that same initiative and put it in our bodies, in ourselves. We have to reinvest in ourselves. And vegetables are expensive. So when we come to the church and we drop off 100 boxes, that literally cost me over $22,000. But the church didn't know that. The church has not yet started to take up a building fund or some type of fund that can sustain, because our administration now has been intentional about getting our money down to Black farmers that they can't find because they really don't exist. So that money sits. So I'm becoming a big advocate on how we pick up the money off the table. But we have to change that. The church has to be able to come and say, hey, let's take up $5 a family this week, and let's be intentional about purchasing vegetables next month. We don't need a grocery store. We just need to purchase our own vegetables. We don't need a grocery store. Because the grocery store, if you look at the aisles, what is the aisles? It's processed. It's the same things that are going to look the same way 2 years. If the grocery store closed and there was a natural disaster, just go in the grocery store 2 years and that same preservatives are going to be there. That means our bodies are going to be in the same places. So we have to learn how to feed ourselves and feed our souls. So we have to look at the narrative and reinvest. Vegetables are expensive. They're not cheap, but it can be cheap. You can buy a whole meal for $35 for 3 days. When you went to Outback and spent $75 for one meal or 2 meals. So we need to get smarter. We need to really invest in ourselves.
It's all about education, right?
It's all about
We as a
education.
people, we need to be re-educated
Mhm.
about, how we conduct ourselves.
And if anyone's had the box, you know that the beets and the sweet potatoes and the cabbage and the kale, they taste nothing like what you get in the grocery store. It's a whole nother level of life. So that's why we named ourselves Glow House Agriculture, because we want our bodies to glow. God created us. We are the creators. We are the first original people in this world. We glow. We should be doing that now. We're not at the bottom. We're not the minority. We're the majority. And we need to start acting like we're the majority.
That's true.
All right, Ms. Carter-Williams. So, access to healthcare has been an issue. So if people have questions about eligibility and they want to apply for Medicaid, who should they contact and how?
Okay, thank you. Yes, very important question. If you haven't heard, Medicaid is expanding and has expanded in North Carolina. Yay. So we're very thankful that worked out. Thank you all for made that possible. I don't know if y'all saw the article. I saw it was yesterday today, where 400,000 North Carolinians have Medicaid now. So this is amazing services that we have. So we're so thankful. But as far as, as a enrollment broker, we're there to assist people with choice counseling, help them understand the process. If they want to change a plan, we are not the one they go to apply. We do not handle that. The lovely DSS people, Shay in the back. Hey, Shay with Gilbert. There are several ways, thank you, Shay. There are several ways to apply for Medicaid in North Carolina. There's EPASS, EPASS.nc.gov. You can also physically go to your DSS. You can call your DSS. You can also do a hard copy application and mail it in, although she was pointing out to me earlier that it's better to, if you can do it online and it's posted again, that, the mail works, it works. It's just there are other options, and I believe you have applications in the back. Yes, she does. Yay. So, those are the ways to apply, and, the process, there are, like I said, multiple ways to do it. But expansion has happened, and we're so thankful for that, so please let people know so they can take advantage of this and get those, get their needs met. And of course, the added benefits that the plans offer as well. And, if any other questions come up after the presentation about Medicaid, please reach out to Shay in the back. She'd be the ideal person to answer those questions about eligibility. And then one more thing I'll say before I finish is, with expansion, that increased for people from 19 to 64, live in North Carolina, whether it's there, have a higher number. People can make more and be eligible for Medicaid, and people that are not U.S. citizens can be eligible as well. It depends on the criteria. Well, they're carved out services, so if the
I can't hear you.
All right. It's a carved out service, meaning that it is covered by Medicaid, but you need to see if the provider, the dental provider, is a Medicaid, receives Medicaid. Did I speak that correctly, Shay? Thank you. Shay's nodding her head. You just need to verify that the dental provider does accept Medicaid. And so your card, someone has Medicaid, and it's going to say a health plan name on there. The number on the card is the Medicaid number, and this will be their way to find out from that dental provider, do you take Medicaid? And that's what they need to find out. Anything else I should add, Shay? Thumbs up. All right, thank you.
I wanted to ask an additional question, just from my own education. So it used to be, years ago, that whether or not you were qualified for Medicaid depended on income. And that was pretty much the flat criteria. How has that changed? Or is that still the primary driver?
Well, now their options have increased, so now we've got people 19 to 64 was the new ad, and also their income levels could be higher. So it isn't just that isn't just, it's more open now. So people have an option.
Is there a general, if you're trying to decide, should I try to apply for Medicaid, is there a general income cutoff?
Just in the size of the family, is there anything else I should be adding, Shay?
So I would suggest, humbly, respectfully, professionally, is that if this is a service that you need, please apply. It's very hard to tell somebody you're eligible or you are not based on that one little criteria. There's a lot of things that go into play when we determine eligibility, and thanks to Medicaid expansion, we're able to say yes to more people than ever. So please give us a chance to say yes to you.
Thank you. As you couldn't hear Shay, please apply. If you have any questions, applying is the way, because there are other factors at play. So this way you can get a full answer and be able to take advantage of this. So thank you guys.
Thank you. All right, I'm going to address the next question that I'm saying. What is the Oak Street healthcare model, and how does this model serve as preventive healthcare for Black community?
Okay, so the way I typically explain our care model to, especially to newer patients who came in to Oak Street Health is Oak Street Health is part of a small minority of clinics in the U.S. That's about 5%. Our care model is called the value-based system. The way this system works is as compared to the fee-for-service system, where every interaction with the doctor's office generates a bill for your insurance, and some of the time that bill comes to the patients. Oak Street Health, we basically get a set fee for Medicare to take care of the patient. That is also based on how complex the care how complex taking care of that patient is. Okay, meaning everything you do at Oak Street Health doesn't generate anything else. I tell patients you can come to Oakwood Health once a day for the next 30 days. So everything you do at Oakwood Health doesn't cost you different things. Okay. To add a little bit more on that. I was listening to everything everybody else was saying, so I had a prepared answer, but listening to everybody. So it seems like to me, based on our care model, we do a little bit of everything everybody talks about here. The first thing is starting with her. We at Oakwood Health understand that healthcare doesn't happen just by going to the doctors or by going to the hospital. Healthcare also happens in the community in which the patient lives. So that's why at Oakwood Health we focus a lot on what we call the social determinants of health. One thing I've learned is if you don't know where your next meal is going to come from, there's no way you're not gonna care about the type 2 diabetes, you're not gonna care about your blood pressure, you're not gonna care about everything. As a result of that, one of the things we try to do at Oakwood Health, we have a wonderful team of social workers. We focus a lot more on food insecurity and also housing insecurity. Just provide the patient with resources in order to get the food they need. After this, I want to talk to you to see, if I can use your example to guide my patients. And the next thing is with her, at Oakwood Health, we also have what we call our patient relation manager. She is a great resource for our patient at Oakwood Health. She is the expert in insurance, including Medicare and Medicaid. When I have any issues related to any of that, let's say my insurance won't cover this medication, or my plan is not going to cover this, or something like that. That's her name is Margaret. Very, very nice resource to have at Oakwood Health. I get all my patients to her because she is the one who answers all of these questions. And also, you talk about transportation, you also talked about transportation. At Oakwood Health, we do provide transportation for our patients, but I feel like it's a little bit limited in what we can do, unfortunately. We provide transportation to patients who live within 10 miles radius of the clinic. One of the things that typically breaks my heart is, Oakwood Health is a primary care clinic, so we do have to refer patients to specialists in the community. Yes, we provide transportation to those patients when they come to Oakwood Health. Unfortunately, sometimes it's a whole lot more difficult for them to go to their heart doctor because they don't have transportation. We try to work the best we can to provide them with information. A lot of time, the insurance will provide some transportation benefits to it, and it's, like I said, it's a little bit limited in how we can help the patients. And especially if we take care of a lot of older patients, and a lot of time they need assistance just getting out of their house. Because sometimes a lot of this transportation, if they come into the patient's house and that patient can't get out of the house and get in a wheelchair, they're just going to be, they're not going to take care of them, and the patient will end up missing their appointments because they just cannot get out of the house. We don't have assistance. I feel like Oakwood Health is one of the few places who do a lot of this thing like that because, like I said, healthcare does not happen just in the clinic. When the patient comes in and sees me, doesn't mean everything is taken care of. So they're going to go back to the community. you have no idea how difficult it is sometimes to have a conversation with a patient who have type 2 diabetes, but all they can afford is the fast food. The fast food. I can talk to them about medication. I can talk to them about but if they go home and all they can afford to eat is just McDonald's or order a KFC or whatever the case may be, because those are cheap. Those are cheap. And she was talking about the processed food at the grocery store. If there's a disaster and then the food stay there on the shelf for 2 years, and you can come back 2 years later, that food is still going to be there. I don't know if anybody has seen that video or that on social media where the patty from McDonald's, somebody did it outside for months, and it still stayed. It looked exactly the same, didn't rot, it didn't do anything. So that's the kind of things. Food. That's the kind of poison our patients are putting in their bodies. I think that's it for me. Hopefully I answered the question. I went a little bit longer than I intended to.
But I have a couple of follow-ups.
Yes.
Okay, so I'm curious, is Oak Street Health strategic about where they place their clinics? In other words, are they specifically trying to serve the underserved communities in terms of where they decided?
Yes, Oak Street Health, we are expanding a lot, and yes, we are very strategic in where we place our clinics. Oak Street Health typically place clinics in those locations where access to healthcare is very difficult, or in those locations that sometimes they have access to healthcare, but those clinics moved away and go to a different location. Yes.
Good, thank you so much.
You're welcome.
Green Street would be a great location.
Say that usually.
Green Street. Green Street would be a great location. East Green Street. And the city could come together with some economic development money and make that happen.
Got a building.
You know what? People can walk there from so many different parts of the community. It's a main thoroughway.
Thank you so much. Next question for Councilwoman McKeever. So as we've been talking, as Dr. Sam eloquently stated, healthcare, the majority of healthcare happens outside of the doctor's office. It happens in the community in which you live, and you age, and you learn. What are the current infrastructure improvements and outdoor educational and recreational program investments targeted to facilitate expanded youth, outdoor educational and recreational programming, and increase self-directed use of outdoor spaces by the community? When I say self-directed use, you as an individual want to go use a facility.
Well, our recent infrastructure improvement starts out with City Lake Park. We renovated the pool, we renovated the rec center. We also put a pedestrian bridge that connected from City Lake up to Piedmont Environment Center. And also, we have 3 greenways. We have the High Point Greenway, the Bicentennial Greenway, and we also have the Heritage Greenway. And they are connected through each other as you can walk from certain parts of the city, you can walk on these greenways. And we're still working on the Heritage one. And also, in the Piedmont Environment Center, we, people go there, it's on Penny Road. And what they do at the Environment Center, they teach environmental education to kids and to the families. And what they do is they have animals as if inside the facility, but they also have a walking trail, which is 6.6 miles. And as we walk and we go to wooded area, it's not just open, it's all wooded area. And then, and also with the greenway, I should say earlier, that it's over 11 miles to cross this greenway. But also, we have different rec centers that you can go to. We have programs. We have things like camping. We have summer camp. We have after school program. We have a program that we use for our seniors called a HOR. It's an exercise class for our seniors. And I attended, and I'm here to tell you that it works. Because when I was informed about it, I went, with my friends, and it's a good workout. I believe it's a good workout. It's over at the Oklahoma Mall, World Cup Center. And also, we do exercise with our young kids, doing our other program. And also, we go on trips. And they go on trips. We teach them and play all kinds of games where they can get, involved in it. Coming up, our kids to be active and not sit around a lot. We notice that sometimes when kids come to summer camp or at the school program, they don't want to be involved in activities. They want to sit and play games and not get involved, but they'll play them to their home. So we try to keep our kids active and keep things open to where people can come and then they can walk around in our gymnasium for 30 minutes, which is good, 30 minutes a day. And also we offer two kind of athletic programs. We do basketball, we do soccer, and T-ball. So we have all those going on right now in parks and recreation. So I think we're doing a lot trying to reach out to people, but I can't honestly say that people really do use our Greenway a lot because of how long it is. Like I said, over 11 miles. A lot of people didn't walk, and we have one near off Lexington Street. We have one off Peyton Road. You can get on, and it goes around like through the city. So depending on where you live, and you can get on one, and how long you want to walk. You can get good condition, walk somewhere. But if you're not, go 30 minutes and come back, and then you're gonna do a workout. But that's what we're offering right now to different people, to people in High Point, and to the High Point of all ages. I'll ask the question.
So I want to follow up a question, because I'm just thinking that. And so, when you mention these great facilities, trailways and walkways, what I hear is that people are going to have to be able to access that from a transportation standpoint. So are there thoughts to creating more green spaces in the immediate neighborhoods in which people live, so that that's not a barrier? And it's easy, and it may not be an 11-mile trail, it may be a park that has a 1-mile loop or something. Are there people in the city of High Point thinking about creating those green spaces in the local communities?
Well, majority of our greenways are in our community. You don't have to have transportation to get to these greenways. But we also, in our master plan in Boston Bay, we're extending the other greenway coming in down East Chester, and then add a sidewalk also there. So our main goal right now is to be able to connect all of our greenways to people who don't have access to transportation will be able to come out their house and walk a block, and then you get on the greenway. They don't have to walk literally far, but it goes through High Point.
Thank you so much. Next question, Mr. Venable. If you could reimagine the future of transportation in High Point, what would that be and how would it be funded?
So I think I'll tackle the funding part of that question first. So that is always our biggest issue is how do we fund our system? So currently, just to give you an example, the High Point Transit System has an operating budget of about $6 million. For failures, we get about, on average, about $300,000 per year. The rest is subsidized with federal funds and local dollars. So the key, I think, is how do we maximize those federal dollars that we do get? And I think, and I'll tag on with what the mayor said just a minute ago, I think that having a system that is accessible, easily understood on how to use it. One common theme as far as, the branding of our system, right? So right now, if you're looking at our transportation system, just in Guilford County, there's 4 providers currently: High Point Transit System, GTA, Park, and then Guilford County Transportation. So I would envision something where, to kind of reduce confusion, is to have one unified system. And as the mayor said before, you're dealing with jurisdictional boundaries when you're talking about this. So you're going to have people that come together across boundary lines to make something like that happen. And that won't happen overnight, but I think to best serve our customers and the people of High Point is to have it. So if you want to go to Greensboro, you know what, there's one bus, one single branded bus that looks the same. You have a call center that can connect you with anybody that will know the whole system throughout the Guilford County. Currently, there is a task force that is developed by Guilford County commissioners to look at just this thing about how do we better serve our customers, our citizens, to get them to jobs, to healthcare, and how easily can we do that? How easy can it be as far as riding the bus? Make it as easy as possible. One of the things that we talk about, Greensboro and High Point are so close. Our transit systems don't connect, except at one location. We get a Jamestown Community College, so we have Greensboro goes there as well as High Point. So we have that connection, and then there is a Park connection. We have a couple. You can take Park from the High Point Transit System terminal straight to the Greensboro terminal through Park Express, which runs from Thomasville up to Greensboro. The other option is taking Route 3 for Park Express up 68 Eastchester into the Coble Transportation Terminal in Greensboro, Park Hub, and then getting into Greensboro. Problems with that is you have to make several transfers. So if you have a doctor's appointment in Greensboro at 10:30, you need to leave. You may not make it because you can't leave early enough to get there. That's one of those issues, and it's a combination, right? So you have that one unified system. You got to look at just, when we talk about it, as far as regional system goes, you can maximize those dollars because we all get federal dollars to run our transit systems. And it's based on, there's a formula, but it's based on population and different things like that. But if we can develop a system from even a triad system, we have Park, but even expanding on that, so you can still have a High Point component and a High Point transit portion, but have a unified branded bus that says, it may be Park, it may be something else, but just to reduce the confusion. And as I talked about earlier, the micro transit, so how do you still serve those areas in High Point that our transit routes don't currently get, right? So we have several areas like that. We can do something with micro transit. We'll get those local trips, more of like an Uber type trip. So, but it all goes back to funding and how much money it would take to run something like that. And it takes all the jurisdictions in the area coming together to make something like that happen. I will say also that as far as working with Guilford County and what we're doing now, I think it's a good start. We have I think the jurisdiction is going to look at a resolution to try to begin the process of making something like that happen. So I think that's key. And of course, like I said, the funding. So.
All right, I want to go back to Councilwoman Keeper for this question. If you could reimagine eliminating food deserts in your ward, what partners would you include and how would you champion building the economic base for the necessary infrastructure to achieve that goal?
She said, how I eliminate food deserts and what partners do we use?
Yeah, if you could reimagine eliminating food deserts in your ward, what partners would you include? And how would you champion building the economic base that's necessary to achieve that infrastructure?
Okay, if I can imagine eliminating food desert, I would look at and visit and talk to people that works and volunteers in our community gardens, and also funding local farmers, like the lady on the end right there, and also, food bank. But a lot of what we try to do is, we get transportation going, and we are able to help people to be able to go to the grocery store. Because right now, like I said earlier, in certain areas in our city don't have it. But we can try to find a way and work together with transportation department in the city to come up with a good plan to help work with each other, try to get the transportation going. That would be really good. And also, new businesses, if we can offer some kind of incentive, they will invite new business here into the city. And that way we can get jobs and get education, and hopefully we can use that money. And then when people notice that we got new business coming in, maybe they want to come in, and also we get funding for that. And also, we have external investment that might want to come in, and also get our money. And hopefully we can get things worked out, and we can get all the, try to get a chance to get a grocery store. And my main goal when I first was elected at city council, and talking about food desert. And this was a big thing on my mind, and what I actually been trying to do. I've been trying to contact other supermarkets, grocery stores, trying to talk to the district manager, just to find out what can we do here in the city of Hawthorne to get them to come and bring them in the grocery store to our areas and in our areas that need a grocery store. So right now, we like this on the top right now, is talking back and forth. We have not gotten very far with it. So as we continue to meet and communicate with one another, then I told them I want to invite, the mayor and city manager to come along with it, and also some of the city council. Because if we can do this, it will be help to us. And then we can partner with urban farmers, we can partner with bank and capital providers. Also, we can partner with city government, federal government, county government, state government, and hopefully that we can get some kind of funds from this government in order to help us out to move forward and try to help us eliminate the food that's in our home.
Let me answer the question.
Okay.
So, when you're in the midst of having these conversations with the grocery store district managers, I'm just curious, do you have any sense of why these deserts have been created in our communities? In other words, there used to be grocery stores, and then they're gone.
Right.
Why are they gone? Like, do you have any sense as to what that's all about?
Yes, we have one out of our points, saved a lot. But people were going in and stealing a lot of groceries. So they were not making any money. And so therefore they had to close down. And also the fact that we have people like hanging around the grocery store and sit down in front, asking for money. And so that's one reason why it left. We also had one on vacation. It's called Bottom Dollar, and it was making good money. And then Food Line decided they had about too much money, they decided to take it back. Because it was up on Food Line, entity up on Food Line. So remember, May was so good and great. Food Line decided to come back and turn into Food Line. When they did that, everything went up. Price low income community, if we can increase wages, you can make more money. And then you can go back to these, grocery store, and talk to the district manager and find out and get more information and ask them to come back and to reevaluate the area again. Hoping that we do have enough income coming in to want to come in and put in the grocery store. But the main thing is that they look at the area and how much income is coming in the area to decide what the grocery store in their lives.
So those were all the questions that I have available to. So at this point, we're going to move to questions from the audience and our online audience. I'm going to let them verbally ask questions. Okay. Okay, I'm going to address this to Ms. Austin. So someone wrote here, how can we help? Do you have volunteer opportunities?
Yes, funny you all say that. Yes, we have volunteer opportunities. We're starting our volunteers, starting to apply April the 15th. And what we do with our employees now, we talk about grocery stores, food deserts. We give our employees each day something to take home with them, something to share with the neighbor. But our volunteers, we would love to have volunteers. We partner with A&T as well, with the Department of Ag there. And we would like to see our volunteers at least 4 days a week. And we ask volunteers to come maybe give an hour or 3 hours or whatever your time is. But be intentional about when you come, about who you want to pack a box for. So while you're there, you pack a box for someone else, a neighbor, a friend, a family member. But also, we want to build relationships. So as you come as a volunteer, you may be coming from somewhere I have not partnered with yet. We would love to partner with more people in the community. So this opportunity for you to volunteer your time, change the narrative in our community, but it's also an opportunity for you to get your organization involved as well. And you can go to lowhouseagriculture.com.
This is a question that goes back to Councilwoman McKeever. The 5 Points area is an ideal location for Oak Street Health. What can be done by the city to bring them into the area? And how can the city bring us more free health clinics? Free health clinics.
Okay, well, I feel like that we can do as far as the city, the 5 Point, as I was talking earlier about areas that, with low income, that have a grocery store, but I was talking about 5 Points. And what I would like to see in 5 Point is, the area where they had stabilized is, I would like for us to put more lighting there, because we got a lot of lighting that lights up the place. People have things that can try to go and break in a lot. We have more surveillance cameras outside the area, the parking lot. And then that way, hopefully, that we can get come in there. But first, we gotta provide jobs for people in that area to bring up their income. Because when I was looking at this about grocery store, about income in areas that had low income, I found out that 25% of the people in household live on less than $25,000 a year. And 30% of that goes towards the rent and the utilities. So how can someone survive off of that? So we've got to try to find a way of bringing the business in, people can come in and move jobs in, and try to make their income rise up to where you can get this to come out there in 5 points. We also got to do some more renovating out there in 5 points. After that, we got to renovate the 5 points. Like sometimes people don't like to go to an area that don't look decent. It gets run down and people don't trust it a whole lot. But if we can get there and, and renovate out there and put up nice signs and more lighting and increase salary. Y'all might be tired of saying increase salaries, but I'm saying it for a reason because people need wages. If they are getting a raise, how can they survive? Because think about it, 25% of people here in High Point, it's $35,000. So how can they not be able to do anything? So we as a city will come together and hopefully work together and try to find out a solution. Do we have all the answers? No, we don't. But are we willing to learn and research? Yes, we are. Because our goal is to work hard and do his best for the citizens in High Point. So as we go forth and look more into this, do more research, and see what we can do at 5 Points to make it a better place to work, because so we love to come there and do that in 5 Points. We'll try our best. I probably won't do it, but we're gonna work hard as we can to try to get that done. Okay, thank you.
I want us to look at, just close our eyes and look at, we always think about a job. A job is normally somebody who's not white is gonna own the business, but black folk don't own any businesses really in High Point. Of statute, meaning $1 million businesses, some $1,000 businesses, we don't have a footprint either. So how can the city promote entrepreneurship? We have a whole generation coming up behind us. How can we promote them, GTCC, trade school, A&T, whatever that looks like, city grants, not $5,000 grants, real substantial grants that you can get off the working capital off the ground. How do we promote that? How do we promote not waiting on some white savior to come and give us a job? No disrespect to you, Councilman, but how can we promote entrepreneurship? How can we own our own? A lot of things, we have a nonprofit. We don't promote our nonprofit, we promote our for-profit. Because again, we're 8 generations on our Century Farm. I can't leave anything to a nonprofit. So we have to start getting smarter and look at how we build entrepreneurs in our community. How are we the ones that bring the grocery store? How are we the ones that do the reconstruction in that 5 Points area? I think that can change our footprint. But promoting more entrepreneurs and not more workers. Because we're the invention of all things. Why are we waiting to get a job from somebody that doesn't look like us? That's going to give us the short end of the stick.
This is an interesting follow-up question, and anybody who wants to address it can. The person who asked the question indicates that, we have these food deserts, and a lot of these communities that have food deserts have these small community stores. So what are the thoughts on working with these businesses, these small community stores, to educate and expand their ability to provide healthy food products?
First, we need to own the community store. That's first. We don't even own our own stores. We had a farmer's market over on Wynn Street, and we would watch our brothers and sisters line up, and I'm like, God, what is the line for? 9 o'clock in the morning. They were going to start serving beer. They weren't there to get biscuits, food. They were there to get beer. Green Street is one of the only places that I see when we pass by, our people just sitting around, like 8 people I saw just sitting around the other day. You don't see that in the white community. So one thing about greenways, we don't walk. It's a thing. We don't exercise. We're not those type of people. We need to look into that. We need to figure out how do we walk, and worry about communities and things like that, but I think I strayed away. I think I strayed away from the question. I'm just so passionate about our people waking up, like, we need to wake up and see the things right in front of us.
Anybody else have any thoughts about partnering with the stores that possibly exist in the community?
I don't, I think you said with her, you are working with that when we realizing, how point, and we're trying to get entrepreneurs to come in, young ones to come in and get a business started. We're welcoming open arms for anyone that want to try, but the problem is with people, that's what you're saying, we own our own business and having our own business. But until we realize that we're not in bondage anymore, we won't bow down to people anymore, and just take the jobs they give us, and realize we are very intelligent enough to go out there and do our own. It won't take that to do that, because we're raised up, and each home is raised up different. And we need to raise up in a home where you don't believe in, working, or you can't get nothing, all you like is all my life. But you got other families that raise up kids in their home, let them know you are smart. You can do anything. God created good. He created us and he made us good and powerful. There's nothing we cannot do, without God. So therefore, what we need to do is to get out and move forward. So we have opportunity for people to come and work and start their own businesses. But they got to realize themselves that they can do it, and some of them are afraid to step out and try to start their own business, and then a lot of times when we can start their own business, there is money that they can give for first-time business owners and brands. So, and a lot of people don't know that, you know what I'm saying? And we did a financial advisory class here at our church. And we learned all these things. We had a really good person that taught the class. And we started off about credit scores and everything. But she kept always saying to us, even though you're doing this and you're credit right, but never ever doubt yourself. Your goal should be you want to be on your own business. You got to believe in yourself that you can do this. And so we have to believe in ourselves and know that, we are smart enough to do that. And so I just encourage people a lot of times when you're around people and they got low self-esteem, we got to reach out to these people, because they've been walked over for so long. And everybody don't have strong parents. My mom raised us up, let us know anything like what's happening, we got to fight, we got to work for it. And that's instilled inside of us. So it's what we did. We believe in working and do what we got to do, And so I just want people to understand, if you're here and people online looking, don't be afraid to tell your family or your kids that's growing up, the children that's growing up, that they are smart. Smart people. And there's nothing that we can't do. We're going to put our mind to it and set goals and fight for those goals and then reach out, because there are money out there. We run that in our financial literacy class that we have in here. I'm connected to the person, okay? But I think some of us is just scared to take that step.
And we don't know the resources. I have a new business in High Point, and my father can vouch for this. He hasn't been dated, courted, or anything. We don't know of any financial assistance that the city can give us to build our business, to even start the business. So that's a conversation, it's access to, it's the resources that you just spoke about. I'm highly intelligent. I built my business up to $500 million just in a year. I need to know how can you help me, because you see, I'm sitting here and I don't know about the opportunities that the city has for me as a young, new business owner in the city of High Point. So it's that simple to say that I'm here and I don't know about the resources that you're speaking of right now. Imagine the people that don't have a voice like me.
How would they ever find access to what you're talking about?
Exactly. Because what was went through the city, it was here in our church, and we got a grant. And we publicized it, we put it out, and people came, but, and then they asked us to go out and bring friends with us. And we are continuing the program, in this month, I think it's the 27th of month, this month, we'll be right here, thinking about finance. If you wanna come, be right here, and it's at
10:30.
10:30.
But I was speaking of the funds available to the businesses.
We cover all of that. I make sure that everything, like the LLC, I'm not this one, but we are taught how to get one, get started, for your own business. And there's a lot of things people didn't know. Because like, if you have your own business, and then you got your own personal checking account, it got to be two different accounts. You can't be the same account.
People don't know this.
People don't know this, right?
Businesses.
Right, so, but I do this right now, we do offer that class, and the lady that teaches this class, she do one-on-one with people. So we want to find out a lot about it. You know, I can get your information, and I can contact her, and then she'll contact you about it. But please spread the word about the financial assistance that we've been having here. Let's go ahead and.
April, when did it start? Oh, it started last May, last
So
June.
last May, and now we're on April, and we learned a lot. Okay.
I have another question here. I'll address it about the same. So the question is, if it takes a village to thrive even in our health and wellness spaces, journeys, how can we partner by going into the community and teach health and wellness? In other words, it sounds like they're wondering about, instead of people coming to the healthcare facility, how can education get out to the community?
That's a great question. That's a good question. So as far as teaching health and wellness, how can that come out of the clinic into the community? So it's something like this. But the issue that you mentioned earlier is we have this type here. That seems to be a very good opportunity for people to come in and learn about healthcare and resources in the community. But if we put it out there, are people going to come in and learn? That's one of the main concerns. Yes, we can set up these things, but are people going to come in and willing to come in and learn? And we spoke about a lot of different barriers earlier as far as transportation and other issues. If we set it up, are people going to come in? That's one of my main concerns. And to add up to past questions, yes, we're talking about bringing entrepreneur and things like that. But my view on this is we live in a low-income community, and I don't know if anyone has heard of Maslow's hierarchy. Maslow's hierarchy. Yeah, that's more of a medical to nursing kind of thing. So if we live in a community where people's basic needs, food, housing, security, health, and if we live in a community like this where people's basic needs are not being met, self-actualization, that's what we're talking about, is so much higher on the hierarchy than, I don't know if I'm making sense going about it. If people don't know where the next meal is going to be, if people don't know if they're going to have a roof on their heads tomorrow, how can they be thinking so far ahead as far as, opening up a business, volunteering for things, I don't know if I'm making any sense. Yeah, yeah.
One of my thoughts is, the local health departments extending their services to the communities to just educate on basic medical ideas in terms of, chronic disease, or using community health workers
Yes.
to go out into the community to have a direct impact on.
Yes. And also, one of in the Black community, churches are the pillar of the Black community. Can we create create those classes in those churches and maybe invite folks to help? You're willing to come in and teach a basic wellness class, because where I'm from, there's a lot of opportunities like that. You have, if you go to the church and you have that background, and we can set that up and advertise during Sunday services, and have people come in and learn about basic things, blood pressure. It's very common in the Black community, but being in healthcare, taking care of patients here in High Point, a lot of times those patients have high blood pressure, type 2 diabetes. They don't even know what that is. They don't even know what this disease is. They just listen to the provider and take medication, and it would be better if they could understand why the blood pressure is high, why their blood sugar is low. So if we can, in a place like this, we can create opportunities for education, and send us an invite, and we'll answer the call. Okay.
I think that's a great point. As Courtney had said earlier, to try to get people to come out in large numbers to programs like this is somewhat challenging. But in our faith communities, you pretty much have a captive audience. And this was a great opportunity to just introduce, healthy ideas where a large number of people can hear at the same time. It's hard for us as individual providers. We have to affect individuals as they come and do our job to, improve the community one person at a time. But it would be nice to have large people affected with the same information.
Excuse me, here at our church, we had a healthy cooking class, and we took lessons. Our team, was it Heart Association?
It was American Heart, and we do community outreach. When it comes to healthcare, I kind of like to use the motif of my pastor, beyond the walls of the church, outside. And so it doesn't take a whole lot to do these things. There's a lot of healthcare people in the room because I can remember their faces when I see them. But we can go out and set up at Macedonia and offer vaccination clinics, do blood pressures and weight management, and educate on diabetes. We've done it, and people tend to come because we brought ourselves to where they are. It feels different than walking in a primary care office and checking in, and I got my white jacket on. People tend to stand back because either they don't trust what I have to offer, or they're a little squeamish thinking I may have bad news. But if I can talk about the wonderful things they eat, about eating vegetables, like we use the Black Farmers vegetables in our healthy eating class, sponsored by the American Heart, along with Chef Creasy. It's not one thing to say eat less salt. If I can make this food taste good, and I've used less salt, and you saw it took me less than 40 minutes to cook, prepare, wash, and eat, and I fed 4 people for less than $30. You can have to, sometimes you gotta show, put your fingers in the holes tight. And so we use multiple avenues. We can't use our offices, we can't use behind our desks, we can't see you at the front checking in, then we'll come to your neighborhood. We'll sit in your parking lot. We'll set up at the Washington Terrace Park if it'll get you out there. It's just being verbal, being purposeful, making movement and meaning. So thank you for bringing it up. I've been sitting here holding my hands for a long time.
But really though, the lesson we took each week, we didn't enough food, we use fresh produce to take home and feed 4 people. And you know, and we
It was fun too. They learned.
Yes,
We
we
talked about diabetes and why you should eat a little less bread, increase your grain. And they was like, well, what's grain? Why should I eat whole grain rice? And so they learned the 3 main ingredients of grain and what this does. So when you can taste it, feel it, touch it, apply it, then you say, oh, now I understand why the doctor told me put down that canned green beans or whatever, because even though it's quick and easy, it does impact the swelling in my ankles. But it was just an easy way to teach. And so if we do more of that, then we have less ER visits. We have improved access because we didn't wait for the bus to come. We just got up one Saturday morning and purposely set ourselves in the underserved community under an umbrella.
And it's so key, right? Because you can't change what you don't know.
Right.
That you need to change.
That's right.
Somebody has to show you first,
Yes.
and then you can take it.
That's exactly right. Thank you, Doctor.
And one thing they told us in that class, when we was raised up, and how we were taught how to cook, was not helpful for us, you know. And I'll be honest, I was like, oh my, you know, collard greens and bad but I did good.
Yes, you did.
I did good. But honestly, I didn't know how it really was going to taste, you know, to me. Now, the vegetables, I got to buy for you, it's delicious. And I honestly, guys, when we get the fresh produce, it's a big difference in the taste. It's a big difference. And I learned a lot from that class. And I went home and served my husband. He ate about most of it. And I was like, cook for 4 people, you know, but I'm sorry. But really though, we do more of those classes, you know, at other churches, you know, at rec centers, where we can have it. But how can we get the people to come out to these classes? You know, because like, you know, we enjoy it. In our literacy class, we had I had 35 or 40 that came every. We had once a month they came out here because they was learning things about it. So. But people send out stuff and you make an announcement and put things out. Please listen or read it and see it. Please share it and take it to your church and post it to the church. Because there's help out here for us. But I'm telling you, healthy food and fresh produce is good.
It's partnering with the school system. It's partnering with the school system as well and going out to those schools and providing the kids, teaching them how to cook and introducing them to a head of cabbage and a bunch of kale. They go home and they say, Mom, I want you to fix that. And then that brings the parents to understanding, hey, let me get this cooking class that the school is offering. So we can start young and then we can go to old.
Listen, so this concludes the forum. Our time is past. I want to thank everybody for participating. I thank everybody. The replay will be posted on William Memorial CME YouTube channel. So thank you all for attending. Please visit the tables in the rear for vital information and enjoy your
Thank you.